the statistics are that for every decade you age, you have that percentage chance of developing a hiatal hernia. So if you're 50, you have a 50% chance, 60, 60% chance, and so on. Now, those are the stats, but do we have to be a statistic, or can we counter that statistic and not fall prey to this condition? Because hiatal hernia, we talk about hiatal hernia syndrome, so let's talk about it from that perspective, involves over 20 different symptoms. And we're not talking just about really uncomfortable bloating and gas, but we also talk about acid reflux, trouble swallowing, sometimes regurgitation of food, not to mention scary heart palpitations, shortness of breath, having panic attacks and anxiety, depression, which just goes along with feeling so terrible. Sometimes there's constipation or diarrhea. Then you have trouble sleeping. You don't want to eat because you feel so terrible when you eat. There's a lot of symptoms associated with this. So it's a syndrome that if we can avoid it, we need to for our overall health, because if you have an unhealthy gut, it's really impossible to be optimally healthy. So there's so many things that fall into this syndrome. So I wanted to discuss this association because I hear it a lot from new patients. It's like, well, my doctor said, I'm in my 50s, so it was 50-50 chance, or I'm in my 60s, I have a 60% chance, like it's inevitable. And it's not. I really don't believe it is, and that's what we see here at Root Cause. So what's talked about is the fact that the diaphragm muscle weakens with age. So the facts are that most muscles weaken with age. The diaphragm is a very strong muscle, but it is a muscle. So just like any other muscle, what happens as we get older is we tend to lose bone density, we tend to lose muscle strength, and we tend to gain more fat. And so we're in this weakened state, and yes, that affects your diaphragm as well. So its ability to sort of keep that stomach where it should be, which is below the diaphragm versus creeping up above the diaphragm, that gets compromised. So the facts are that we can do a lot for our overall muscle tone and strength, and we need to work toward that regardless of what our age is. The other thing that's mentioned along with the diaphragm weakening is that the lungs are losing their elasticity. Again, that speaks to, it's a use it or lose it kind of philosophy where are you making your lungs work? Are you getting out of breath in a good way from the viewpoint that you're exercising? So it is utilizing this body of yours, because the facts are that, they talk about the blue zones, if you haven't heard about that, but it's areas of the world where people regularly live to over 100. They were talking about the fact, and we were actually in Europe this past summer, and there's these beautiful little towns that are always up on a hill, it seems. And that's because if you were up on a hill and you had a protected wall around your village, you could see bad guys coming, so there was obviously a good reason to put your town there. But boy, these are up and down and up and down and up and down. And, there's not elevators, there's not escalators, you're walking. And they spoke to the fact that, whether you're, herding goats on a steep terrain, or you just live in one of these towns where it's a walking town, and you get a lot of incline type of steps, that is just amazing for your lungs, because you're breathing hard, right? Because you're trying to get up this incline. And I would wager, I don't think the study's been done, but I would wager that those people are not only living, into 100 and beyond, but I would wager that they do not have this increased risk, because of course at 100 you'd have a 100% chance everybody over 100 would have a hiatal hernia, which I don't think they do. So it just speaks to what we can do to lower that percentage and increase our successful outcome. Now, the other thing that I talk about a lot is increased intra-abdominal pressure. So that is that pressure within your abdomen. So this is below the diaphragm, that pressure that's pushing up on the stomach, that's aggravating the stomach, putting pressure on it, causing acid reflux, and also putting pressure on the diaphragm. And if the diaphragm's weakening, it can kind of give way, all right? So in the increased intra-abdominal pressure category, we're certainly looking at chronic constipation where people have to bear down to move their bowels. That's really a chronic way to cause increased intra-abdominal pressure over the years. Also is chronic coughing, so if you have any sort of allergy or lung condition, or acid reflux. So one of the prime factors in hiatal hernia is acid reflux, and people with acid reflux can have a lot of coughing. So, and then the other one was obesity. So obesity leads to every single degenerative disease we're trying to avoid. I'm not saying it's the only cause, but it's a contributing factor. So what are we really looking at here? We're looking at, okay, making sure our weight is good. We're looking at exercise and resistance training so we can build bone density and we can build muscle and we're not getting frail. And you see a lot of people in your life that are getting older and they get smaller. My mother-in-law, I hadn't seen her at some point for a little period of time. They lived far away and I saw her and I was like, she's tiny. She's just like has lost mass, right? She lost bone mass, she lost muscle mass, and that's not a good thing. But it's the good news is it's never too late to turn it around. So the body loves to heal, it loves to repair. Yes, it's more difficult as we get older, but it's certainly not impossible. So it is very worth our while to do deep breathing exercises, push ourselves up some hills and make sure that we're really using that lung capacity. And I know some of you are in a position where you're having issues that are preventing that. I understand that. I'm not insensitive to that, but I'm just saying that first of all, we get you healthy. So we have a lot of patients who, my goodness, were elite athletes and now they can hardly walk to the mailbox and back without getting out of breath. Okay, that's a problem we can handle, and then we build, you know. But it's that building, it's that having your body regain that optimal integrity that it knows how to do and it loves to do with the right help. And we've been meeting some older patients recently, new patients who have, their doctors have just kind of given up on them. It's like, you know, you hit 70 and it's like, well, you know. A woman recently who had the virus and got really sick, and then her liver is just basically shutting down, and she doesn't have liver disease. She has no history of alcoholism or anything that would cause such damage to her liver. And it's like, okay, so she had a reaction, but the liver as an example, all organs, but we talk about the liver often just because it's the only organ you can cut a piece off of and it will regenerate. There's only one like that in the human body. And so, you know, the body loves to heal, and there's a reason for these things. So just because you're feeling kind of lousy right at the moment, realize we can, well, 85% success rate chance of getting you back to where you need to be, and then build from there and retaining that gain. So that's the whole thing is you regain it, you retain it, you know, and then you enjoy life more. So I did want to speak to this, but because I think very often people diagnosed with hiatal hernia who are 50 and older are told sort of like, well, what'd you expect, you know, your age, there's nothing we can do. And that's not true. There's a lot we can do. So until next time. Oh, if you like the channel, please subscribe and give it a thumbs up.